To start off with, I hope you will indulge me with a bit of an activity. So if I can get you all on your feet, don't worry, you're going to get off lightly. When I do the exercise with the doctors, I basically make them do a whole ballet routine, so it won't be too difficult, I promise. Okay, so you can either answer for yourself or you can answer for the team that you lead. So I'm going to read out a list of words, and I want you to tell me to sit down if you know what that word means. Dyspnea, epistaxis, syncope. Okay, so quite a lot still standing, as I would expect, otherwise my exercise would not be working. So if we stand back up again, if we sat down. Okay, now if you understand what I'm talking about now, shortness of breath, nosebleed, fainting. The first list that I read out was the medical jargon, and the second list was the plain English version. And this is exactly the problem that I've come to understand as part of my time at Nightingale Hamilton. So I'm Calisha, I am a PhD student at UCL. My background is as a public health doctor, and my interest is in health literacy and health numeracy. So health literacy and numeracy is your ability to use your reading and writing skills and your math skills, but in a health environment. So for us in care homes, that's reading discharge summaries, reading the labels on medication, or if we're supporting a resident to have a conversation with a GP or another healthcare professional. But my story actually starts as a second-year doctor in A&E. So I was in A&E and I was asked to see this patient, and she'd come in every few months with tummy pain. No one knew what was the cause of this tummy pain. She'd seen multiple specialists, had every test you could imagine under the sun, ones I'd never even heard of before. She was known to have celiac disease, so that's a condition that affects your gut and makes it hard for you to deal with gluten in your food, so you're finding that in wheat, flours, spaghetti, bread, that kind of thing. Causes things like tummy pain and other symptoms. And she was also had a serious mental illness and was being supported to live in community by a care worker who would support her with things like her shop as well. So I went to see her, and she asked me to read her diary. Now, it was A&E, it was the winter, and it was COVID. So you can imagine how foolish I might have felt reading her diary. But I'm so glad I did, because she was writing down everything that she was eating. She was eating curry and naan. She was eating a spaghetti bolognese. All of these things full of gluten. Probably the cause of all these months of tummy pain that no one could explain. So I went to go and speak to the care team to understand what was going on, because of course she still has autonomy, she has choice, she can choose to eat these things. It turned out the care team were aware that she had celiac, but it was the way it had been explained to them. They knew she couldn't eat like a standard loaf of bread, like a Hovis bread. They weren't aware it was in things like spaghetti. And it struck me what a strange situation the care sector is put in. They're parachuted into people's lives at a time when they're most vulnerable and often quite medically complex, but they're not there for the initial diagnosis or the follow-up appointments often to ask those questions and to get that health education. And so that sat with me for a while. I wasn't quite sure what, if anything, I could do about it. But then I had the opportunity to think about what I might want to do for a PhD. And I thought, yes, definitely something to do with health literacy, something to do with social care, but something in the middle, and I didn't know what that was. I did the standard thing, I looked online, I tried to read the literature, but I didn't feel like I was getting a really good question out of it, and I knew I didn't know enough about social care to come up with a question by myself. So I had a chat with my supervisor and Nuno, and I came to Nightingale Hamilton for 2 weeks. I did a mix of day shifts, night shifts, shadowing, trying to help out where I can. Sorry to anybody who got a cup of tea from me. Even my mother doesn't like my cups of tea. And of course, inspiration struck in the middle of the night, as it always does, when Therese, one of the senior care workers, said to me, you know, a good discharge summary means good continual care. And we had a chat about different discharge summaries and things that she had seen in discharge summaries that just didn't make any sense. And for the first time, it was a light bulb moment, because I had, of course, written so many discharge summaries, and I dare to think of what they were like. But I realised what it was like for the reader on the other side. So my research is looking at how we can improve continual care from hospital to the care home by improving the way we write discharge summaries. It means getting rid of that medical jargon, it's just not necessary, but also thinking about the content and making sure that it meets the needs of social care. This has been beneficial both in terms of coming up with hopefully a really good, useful question, not something that's just going to sit on a bookshelf, but hopefully have an impact. But it really supported me when I went for funding. I was able to have a really strong narrative in my grant application. It also meant when there wasn't quite the evidence I needed to find in a published journal, I had real people, I had real testimony to put into my application. And when I got to interview and they said, does social care even want this? Is this even helpful? I was very confidently able to say yes, and I could describe the problem both from the hospital's point of view as well as from social care's point of view. So being able to come up with a question in social care has paid dividends to me professionally as well, because I didn't know that much about being in a care home. You fly in and out when you visit with GP, so I have a much better understanding, and I continue sort of that commitment to that understanding. So most recently I went down to Dorset with the Dorset Care Association, learning about the Trusted Assessors Programme down there, again learning about the discharge summary, both from the hospital point of view and from the care team. It's not two sides of a different world. We're trying to work together to benefit the same people. Our patients, our residents, they're the same people that we care about. So yeah, so that's my story and probably my time. Thank you for listening.